Hey folks, welcome back to another segment of Veterans Did You Know? And today I'm very pleased to have with me Wendy Austin, who's with Healthy Focus. And we're going to discuss some of the things that helps keep individuals in their home. Whether you're a veteran or not a veteran, doesn't make any difference. If you're a vet and you have a mom or a dad or a sister or brother or somebody needs some home care, and we're going to talk about some of the other issues or some of the other benefits that are out there that you might be able to access that you hadn't thought about. And that's what we're trying to do in this whole community is everybody that's, especially in the healthcare business, is pretty much all connected. We try to be able to refer back and forth where the Healthy Focus would send a vet to us, maybe if life is made in attendance, and we would be able to send the folks to them to be able to keep them in a home. So Wendy, thank you for coming to the show today. Appreciate that very much. And would you like to tell the folks a little bit about, number one, your background, how did you get into healthcare, and what does your corporation do?
Thank you, Dave, and I appreciate you inviting me here today. I got into nursing several years ago, 25 plus years ago. I'm a graduate of Ferris State University, have a bachelor's in nursing and pursued my master's in behavioral sciences. We have a family-owned home care company located in Roosevelt Park.
Oh, okay.
We frequently say that we're right next door to the Station Grill because, well, a
best
lot of
hamburger
people
grill.
know where the Station Grill is.
Yeah.
And we've been there actually 10 years. We're just celebrating our 10-year anniversary of providing home health care services to the area. We predominantly do Muskegon County, some Newaygo County, some Ottawa County. The majority of our patients are in Muskegon County. I'm from Muskegon County. I've lived here since 2nd grade. So this is definitely what I call home. And I own Healthy Focus with my sister. So it's a family-owned company. She had many years, 15 years, at Hackley Hospital. And I had been at Mercy Hospital, and then I went into home care. And about 11 years ago, Shelley and I thought, you know what, this is something we want to do. We want to.
You can do this on your own.
We can do this.
And do it. Yeah.
Right. And we provide registered nurses to go out and assess clients' needs, physical needs, psychosocial needs. We can monitor and assess the medication, look for side effects, effectiveness. You know, sometimes we go in, we see our healthcare provider, and we're not quite sure when we leave there if we're understanding what we're going to do, and then by the time we get home, we're really not sure if we're understanding the routine. And we can always call our healthcare provider and have it reiterated to us, but it's just kind of nice sometimes to have the nurse come to the house and sit down, go over it, get some feedback from the nurse, and make sure that you have a clear understanding of why you're taking this medication, why you're doing what your healthcare provider expected you to do, and if you're able to do it.
Well, I think that's a lot of folks, myself included. You go in to see your doctor, and you're in the settlement. You know they're in a hurry to get you in and out, and they throw so much information at you, and then you get home thinking, well, I like my spouse to go with me and said, you listen to part of what's being said here because I have this, you know, selective memory loss is what my wife says, but you know, what did exactly that? So then how can somebody access your services? Like their insurance or Medicaid or Medicare? Or how do they get to you to sign up for or to get you to help them?
We have clients that come to us through private payment sources, through car insurance if it was resulting from an automobile accident, through health insurance. We also have clients that come to us through Area Agency on Aging. And we are certainly interested in serving the veterans in our community more than we do. You know, I was surprised when you told me the statistic. Yeah, I was absolutely surprised with 14%.
Of the populace are veterans, yeah.
I did not know that.
High populace here in Michigan has always been. It's a blue-collar state, and from every war we've ever fought in, we've always been the ones that signed up and serve. And deaths. We've had 595 from Muskegon County have lost their lives from World War I through Iraq and Afghanistan. 595 from this county alone over all the wars. So we've always participated faithfully, you know, in serving our country. And so we have a lot of vets here in this community, and we have two active reserve unit and an active guard unit.
Absolutely.
And we had hundreds, literally hundreds of folks that have served in Afghanistan and Iraq that are now coming back or in the process of coming home that have healthcare issues big time. And now some of them are fortunate because we get them into the VA, but when they go back home, even the VA can assist in saying, you know, how do I get health care at home? Is the thing we just talked about. I have an elderly mother and father-in-law.
Absolutely.
And boy, to be able to keep them at the home, they respond so much faster. They get healthier quicker, and psychologically, just when you have to.
Home is our anchor, Dave.
Oh, yeah.
Home is the anchor. There's no question.
And be able to come in that environment. And I'm sitting in my living room, and you're going over every medication and why I'm taking this treatment. And then I'm comfortable because where I am, and you're giving me the information I felt like was kind of rushed to me. That's just worth its weight in gold to be able to feel like I'm in good hands medically, because most people are not, you know, medically oriented, and you know, you say, well, is that the right thing to do? What should I be doing? But to have a professional to come into your home and go over this with you, just you know, and that's got to be just tremendous job to have, just to alleviate the anxiety. You must be able to see that right off the bat.
Well, it is, and I know personally that it's nice to have somebody come to me in my own environment and say, you know, this is what the plan is, this is what we're going to do, let's go over it, even with my own healthcare needs. And we all have healthcare needs.
Everybody does, yeah.
And I can personally tell you that, you know, I've been on the other side of that fence. I'm the patient. I've been in the doctor's office, received the instructions, and I'm, okay, I have it, I understand it, and I get home, and I start thinking about it, or I pick up the prescription, and I start reading about maybe the side effects or the indications, and then I start second-guessing myself, and it is wonderful to be able to, I have an RN that I call, that I said, does this sound right to you? Do you think this is what I was told to do? And I see it with my own home care practice.
Well, I think I'm a retired medic at Air Force too. I think we have just enough knowledge to make ourselves dangerous sometimes, so we start second.
That's exactly right.
And I saw, you know, and then you're thinking, is it worse than I think it is, or let somebody else look at this? You know, am I blowing this out of proportion? But just the reassurance of, here's the plan. Let's go over this again.
That's right.
Here's prescriptions. Here's how you need to take them. And what about helping a person that can't clean up? Maybe they had a stroke or they've had a heart attack or something, and they say, well, you know, I don't need to be in a nursing home or you know, a assisted living. If I could stay at home, but I can't, you know, shovel my driveway, or I can't do the laundry like I used to. Can you set up those kind of services? Are you evaluating them for that?
Absolutely. You know, Dave, that's where my whole thing is. I firmly believe that, and I told you that earlier, that as we get older, it's just a part of life, that we are inherently going to go through these changes. And I teach a certified nurse aide training class as well at Healthy Focus. Okay. And it was just I was talking just this morning to some of the students about, there's just certain little landmarks that we pass as we go through life. I said that when I was 39 years old and 364 days, I went to bed that night, I could see close-up print just fine. I got up that next morning that I turned 40. I haven't been able to read small print since. You know what I'm saying. There's just little, and we sustain losses. We have some loss of health. We have some bereavement. These are a part of the cycle of life. We don't have to lose our home or not be able to stay at home, because there are resources such as Healthy Focus that can keep you in the home. Familiarity breeds comfort. There's no question about that. People do better in their home. If you're in a nursing home getting some restorative care, that's your goal, is to go home and be home. You want to return to that anchor, into that comfort zone. And I am a firm believer. And sometimes I do go out as a registered nurse and find out that somebody understands their medication regime. They understand their plan of care. They don't really need me or other RNs or licensed practical nurses to come out and help them with the medical end of it. But I see them struggling with their homemaking needs. I see them struggling with laundry, dishes, grocery shopping. Those are the
Maybe
kind
like
of
food
struggles.
preparation or just, yeah,
Food
yeah.
preparation. This time of year, shoveling the snow. How about one step further, getting to the mailbox? You know, some homes I've pulled up to, there's 3 days worth of newspapers out by the mailbox if the mailbox is at the road.
Yeah.
So a simple thing like having somebody come for 2 hours Monday, Wednesday, Friday, 2 hours Tuesday and Thursday. We get the mail, we can pay the bills with the client, go over the bills, they write the checks, we take them, get the stamps, get the post office, you know, get the things mailed out. What's worse, to write a check to pay a bill and not have a stamp, or not be able to get it to the out mail?
Yeah.
Sure, absolutely. Or, you know, sometimes one partner always did the laundry. You may not have ever operated the washing machine before. That's right. Or maybe you don't want to use the stove anymore. Maybe you want to microwave things. So there might be a few little things you want to know about using the microwave. So we have male and female home health aides. We have chore service. We have personal care aides. There's somebody that can meet the needs and keep people in the home. We run errands.
Well, I think that, you know, this excellent as a male is to, I never thought about that part of it, having male aides that would come out and help out. You know, and as like my in-laws, the same thing was going to the house and decluttering it, because now that one of them was on a walker and one had one of the cane things, you know, and before you had to navigate like this. Well, now it really was hazardous. You know, the rugs on top of rugs.
That's right.
To go through there and say, you know, this, we can make this barrier free, and we can remove these things because you need this now for a hand rest.
That's right.
Or helping them get a bathroom set up with handrails or
I was just going to tell you that that's a part of really going out and assessing the client and opening the case. The first thing I will ask the person, how do you shower or do you go in the bathtub? If they tell me they shower, the next thing I want to know, do you have a shower chair? Mm-hmm. Some people aren't aware that you can get a shower chair, that they're available, that it's something that will even sit in a smaller or rounded bathtub or a bathtub with legs. There's all different styles of them. There's some of the benches in the bathtub and the other half of it is on the outside of the bathtub. That's right, so you can sit down and kind of scooch over, lift the legs over. There's grab, you know, how wonderful to have a bar to grab just to step in and out of the shower. Even if you don't feel like you want to sit down or have the shower bench, you can have something to grab hold of.
I think most of it are probably modest. You know, you always worry about somebody else coming in, especially in the need for personal hygiene, to bathe, whatever else. So, but you're afraid that what if I slip in this tub, or what if I don't have this up? But so that's that part of that evaluation. Here's your home. Here's what your new limitations are. And
That's
see
right.
How we marry this up to make these so these limitations aren't so limiting to you anymore. Then, but you'll do all that for them.
Absolutely, because you know what, Dave? If you don't address the limitations, there's going to be more limitations
or more
as a consequence to not.
Exactly.
Yeah, exactly right. So we're proud of our company, and we have a lot of satisfied clients. We have a lot of satisfied staff as well. One of the features that we like to say about Healthy Focus is we have our original office staff. We've always been Healthy Focus. We've never changed names. We've never changed owners. We haven't ever changed buildings. Never. We've been at the same place with the same name, with the same management for 10 years, and we're proud of that.
Yeah, if you want to stay with us, we've got to take a short break and have the folks have some words of interest that help sponsor this show, and please pay attention to that, but come back and see us. We'll be back in just a few minutes.